So Careways Collaborative is designed to be an educational curriculum for healthcare, where the collaborative part is working with our group in Careways Collaborative with the local healthcare team to safely get patients from the home to the hospital to the home. In order to do this safely and to improve the mortality rates, to reduce the infection rates, we've developed a curriculum that we've learned over the last 10 to 15 years works, and we've implemented it and seen wonderful results. So this curriculum is really going to cover that span from the time they enter and are preoperatively assessment to the time that they're operated, to the time that they may spend either in the ICU or on the wards, to the point where they get safely home. Each step of that journey, we're going to have a separate curriculum for. What is it like to be in the operating room? We have 5-minute instructional videos for the surgeons on the majority of the cases that we do. Each step along the way, we're going to focus in on that step and the transition between the operating room and the ICU, and then to the ICU, to the wards, and then to home. Because we know where errors are made in medicine is in those transitions to care and is in the details on each specific step along the way. What happens in the ICU? How are they assessed? How do we deal with endotracheal tubes? How do we deal with safe central lines? How do we keep the infection rate low? And how do we keep the children or the adults from plugging? How do they then give them a safe assessment plan for feeding? So that's where our speech pathologists will come in. How do the nurses interact? How do we move them and do safe transitions to home from either the intensive care units or the wards? That's the journey we're going to go on in this curriculum.